3 new hopes for type 1 diabetes. Living with type 1 diabetes means your body does not make insulin. For many years, doctors thought this was a complete loss. But today, research shows us 3 new hopes that could change everything. Hope 1. Your body still makes some insulin. Many people with type 1 diabetes still make small amounts of insulin in their pancreas. This happens even years after diagnosis. Many people with type 1 diabetes still produce some insulin. This works even after having the condition for more than 5 years. Some people still make insulin 30 years after their diagnosis. Your pancreas has special cells called beta cells. These cells make insulin. In type 1 diabetes, your immune system attacks these cells. But the good news is that some beta cells survive this attack. But my hypothesis is that body still makes some new beta cells daily, but they get attacked by immune system and get destroyed. Just like if you open the tap to fill a bucket with a hole, it will continue to leak water, but still some level of water remain in the bucket. These surviving cells can still work properly. They respond to meals by making more insulin. This means your body has not completely lost its ability to make insulin. Even very small amounts of insulin help your body. People who still make some insulin have fewer complications. They have less eye damage and kidney problems. They also have fewer dangerous low blood sugar episodes. Hope 2. Metformin can help type 1 diabetes. I will talk about the risk of DKA later in the video. Do not miss that. Metformin is a medicine that doctors usually give to people with type 2 diabetes. But research shows it can also help people with type 1 diabetes. Doctors can prescribe metformin off-label for type 1 diabetes. This means using it for a different purpose than it was originally approved for. In some places, about 15% of adults with type 1 diabetes take metformin. Metformin works by making your body more sensitive to insulin. This means your insulin works better. It also helps reduce how much insulin you need each day. Clinical trials show that metformin can improve your A1C levels. Metformin can reduce A1C by around 0.8% when added to insulin therapy. It could mean getting A1C from 8% to 7.2%, which is a great reduction. It can also lower fasting blood sugar compared to insulin alone. Metformin also helps with weight management. Many people with type 1 diabetes gain weight from insulin therapy. But metformin can help prevent this weight gain. It may even help you lose a few pounds. The medicine works by reducing insulin resistance. Insulin resistance makes it harder for your body to use insulin properly. This is common in type 1 diabetes, especially in people who are overweight. Metformin can reduce your daily insulin needs by about 25%. This is important because using less insulin means fewer side effects and better blood sugar control. Metformin may increase glucagon to prevent hypoglycemia during metformin therapy, according to Science Direct. Hope 3. SGLT2 inhibitors protect your heart and kidneys. SGLT2 inhibitors are a new type of medicine for the kidneys and heart. They were first made for type 2 diabetes. But research shows they can also help people with type 1 diabetes. These medicines work differently from insulin. They help your kidneys remove extra sugar from your blood through urine. This lowers your blood sugar levels. The most exciting part is how they protect your organs. SGLT2 inhibitors reduce kidney problems by 30 to 40%. This works for people with or without diabetes. For your heart, these medicines are also very helpful. They reduce the risk of heart failure and other heart problems. This protection works by reducing the workload on your heart and kidneys. SGLT2 inhibitors improve blood flow to your organs. They help your kidneys use less oxygen, which protects them from damage. This is especially important for people with type 1 diabetes who often develop kidney problems later in life. The medicines also help with blood pressure. They work as gentle diuretics, which means they help your body get rid of extra fluid. This reduces the pressure on your blood vessels. But doctors need to be careful when prescribing these medicines for type 1 diabetes. They can increase the risk of diabetic ketoacidosis, a serious complication. This is why you need to monitor yourself closely if you take these medicines. These medicines protect the kidneys even when blood sugar levels do not improve much. This means the medicines have benefits beyond just lowering blood sugar. Diabetic ketoacidosis, or DKA, is a dangerous complication of diabetes that happens when the body doesn't have enough insulin. This is a major concern among users of metformin and SGLT2 medication for type 1 diabetes. You need to keep the blood sugar within the recommended range, which is between 70 to 180 in US measurement, or 3.9, and 10 in UK and Australian measures. Better still, you can get the monitors with both blood sugar and ketone measuring capability. Even then, if you suspect something is wrong, you need to contact health authorities immediately. Without insulin, the body starts breaking down fat for energy, causing acids called ketones to build up in the blood. This can make the blood much too acidic. DKA mostly affects people with type 1 diabetes, but it can also occur in those with type 2 diabetes if they don't have enough insulin. Symptoms of DKA often develop within hours and can include feeling extremely thirsty, frequent urination, tiredness, confusion, stomach pain, nausea, vomiting, and sometimes a fruity smell on the breath. If DKA becomes severe and isn't treated, it can lead to coma or even death. Detection of DKA involves several steps. Blood sugar is usually very high, but the condition is confirmed by detecting high levels of ketones in the blood or urine, and by finding acidosis with a blood test in a hospital. Standard at-home glucose monitors only measure blood sugar, so they can indicate risk for DKA if the readings stay high, but they can't detect ketones. In that situation, you need to bring the blood sugar down by taking some insulin injections. Talk about that with your doctor before starting either metformin or SGLT2 medications. To actually diagnose DKA, you need to use blood or urine ketone tests, which are available separately. What this means for you. These 3 discoveries give us real hope for type 1 diabetes management. Your body may still be making some insulin, even if you have had diabetes for many years. Metformin can help your insulin work better and reduce the amount you need. SGLT2 inhibitors can protect your heart and kidneys from long-term damage. But remember, these treatments work alongside your regular insulin therapy. They do not replace your need for insulin. You should always talk to your doctor before making any changes to your diabetes treatment. The future looks brighter for people with type 1 diabetes. Research continues to find new ways to help your body work better and prevent complications. These 3 hopes are just the beginning of what may be possible in diabetes care. Your doctor can help you decide if any of these treatments might be right for you. Every person with diabetes is different, and what works for one person may not work for another. But having more options means more chances to live a healthier life with type 1 diabetes. Consult your healthcare professional before changing your medication or lifestyle. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. References are in the comments section. See you in the next video.